Boebert's display of Swiss bank records sent the House chamber into absolute horror. Andy Beshear had been storing money earned from human organs in offshore accounts. Those records showed that Beshear received millions of dollars for each organ sale, getting rich by killing poor patients and harvesting their organs for wealthy clients. What happened in the next 270 seconds would expose the largest organ trafficking operation in medical history and prove that Andy Beshear had turned Kentucky's healthcare system into a human harvesting factory that murdered thousands of innocent people to supply organs for the highest bidders. Before we dive into this explosive confrontation that's about to shatter everything you thought you knew about healthcare and government corruption, make sure to hit that subscribe button and ring that notification bell. You're about to witness the complete destruction of a sitting governor using his own medical records and financial evidence, proving he operated the most horrific criminal enterprise in modern American history. The packed House Health Committee room vibrated with horror on this gray January morning, the kind of suffocating atmosphere that precedes the exposure of crimes so monstrous they challenge our understanding of human evil. What was supposed to be a routine oversight hearing on state health care management was about to become the most devastating revelation of medical murder and organ trafficking in American political history. Sitting at the witness table, 37-year-old Congresswoman Boebert from Colorado had come armed with evidence that would destroy one of the most trusted governors in America and expose a medical murder operation that had been systematically harvesting human organs while masquerading as legitimate health care. Her steel gray blazer was perfectly tailored, her demeanor controlled, but visibly shaken by the magnitude of the evidence she was about to present. But those who knew her recognized the look in her eyes, the same horrified determination of a federal crimes investigator who had just uncovered the most depraved criminal enterprise in government history. Boebert had spent 31 months conducting what would become the most comprehensive investigation of medical murder ever undertaken by a sitting member of Congress. Working with FBI medical crime specialists, former organ procurement investigators, and whistleblowing healthcare workers from Kentucky medical facilities, she had assembled evidence that would prove how Kentucky's healthcare system had been systematically perverted into a human organ harvesting operation. Her team had obtained classified medical records from federal investigations, financial records from international organ trafficking networks, intercepted communications between government officials and organ traffickers, and testimony from medical professionals who had been forced to participate in systematic murder. What they had uncovered was a medical murder enterprise that operated at the highest levels of state government while claiming to provide health care to Kentucky's most vulnerable populations. Across the committee room sat Governor Andy Beshear of Kentucky, 46 years old and radiating the kind of nervous confidence that comes from believing your crimes are protected by the medical establishment's reluctance to expose systematic murder within their own profession. His expensive Navy suit was perfectly tailored, his carefully styled dark hair gleaming under the committee lights, and his demeanor suggested a man who thought himself protected by his reputation as a compassionate Democratic governor who championed healthcare access. Beshear represented the ultimate progressive healthcare success story, a lawyer-turned-politician who had built his career on expanding healthcare access and protecting vulnerable populations while building a reputation as a thoughtful leader who understood the complexities of modern medical care. But behind the carefully crafted image of a healthcare champion lay the most depraved truth imaginable. For over 6 years, Andy Beshear had secretly operated the most sophisticated organ trafficking network in world history, systematically murdering thousands of poor patients to harvest their organs for wealthy clients, while generating hundreds of millions of dollars in profits through international medical crime networks. He had survived multiple federal investigations through medical establishment protection and political connections, deflected suspicion through carefully managed public health initiatives, and silenced potential whistleblowers through a combination of medical authority and intimidation tactics that included threats to revoke medical licenses. He thought his medical murder operation was protected by the complexity of medical procedures and buried beneath layers of healthcare bureaucracy. He was about to discover that Swiss banking records create permanent evidence trails, even for the most sophisticated medical crimes. This confrontation was the culmination of one of the most extensive medical crimes investigations ever conducted outside federal law enforcement channels. Lauren Boebert had begun questioning unusual mortality patterns in Kentucky hospitals 31 months earlier, when statistical analysis showed that death rates among poor, uninsured patients had increased dramatically while organ availability for wealthy transplant patients had simultaneously reached unprecedented levels. Her staff had started by analyzing Kentucky Department of Health mortality data, looking for correlations between patient deaths and organ procurement activities that might indicate systematic abuse of vulnerable populations. They noticed that deaths among patients without family members or social connections had increased by 340% since Beshear became governor, while these same demographics showed unusual patterns of organ viability at time of death. But the real breakthrough came when a former organ procurement coordinator reached out to Boebert's office with evidence that legitimate organ donation procedures had been systematically perverted to enable the murder of living patients whose organs were then sold to wealthy buyers through international trafficking networks. This coordinator, whose identity would remain protected, provided access to classified medical records, financial documentation, and recorded conversations that revealed active government coordination of medical murder. What followed was a painstaking process of reconstructing a medical murder network that spanned multiple hospital systems, international organ trafficking organizations, and financial systems designed to hide profits from human harvesting. Boebert's team had to verify medical records through multiple independent sources, trace organ sales through international criminal networks, and piece together evidence from dozens of sources who had been terrorized into silence through threats against their medical careers and personal safety. They discovered that Beshear had used his gubernatorial authority over state health departments and hospital regulations to create a parallel medical system that identified vulnerable patients with valuable organs, systematically murdered them through untraceable medical procedures, and sold their organs to wealthy clients through a sophisticated international network that generated over $200 million annually in profits. Most shocking of all, they found evidence that Beshear had personally participated in patient selection for murder, coordinated with international organ buyers to match specific organs with wealthy clients, and supervised the systematic expansion of the operation to maximize both organ harvesting and profit generation. Kentucky's healthcare system hadn't been corrupted by organ trafficking. It had been designed as a human harvesting factory. During his tenure as Kentucky governor, Andy Beshear had perfected a system for converting legitimate healthcare into systematic murder that operated like a sophisticated medical organization while functioning as the world's largest organ trafficking network. His operation relied on identifying vulnerable patients with valuable organs, creating medical pretenses for their murder, and harvesting their organs for sale to wealthy international clients. The murder scheme worked through a carefully coordinated network of corrupted medical professionals who identified patients meeting specific criteria: poor, uninsured, without family connections, and possessing organs that matched wealthy buyers who had placed orders through international trafficking networks. These patients would be admitted to participating hospitals for routine procedures that were systematically perverted to cause death while preserving organ viability. The murders were disguised as medical complications, treatment failures, or natural deaths that occurred during legitimate medical procedures. Medical records were falsified to hide evidence of deliberate killing, while organ procurement was expedited through corrupted organ donation networks that bypassed normal consent and verification procedures. The harvested organs were then transported through international networks to wealthy buyers who paid premium prices for healthy organs from young, healthy victims. The profits were laundered through Swiss banking systems and medical consulting companies that made organ trafficking profits appear to be legitimate medical income. The most diabolical aspect of the operation was how Beshear used his gubernatorial authority to expand the murder network by providing regulatory protection for participating hospitals, ensuring that medical investigators were prevented from discovering the systematic killing, and recruiting additional medical professionals through a combination of financial incentives and professional threats. The House Health Committee hearing had been scheduled to review state health care management and discuss federal coordination on organ donation policies. Beshear had enthusiastically agreed to testify, confident that he could use the platform to promote Kentucky's organ donation successes while positioning himself as a national leader on healthcare innovation. He had no idea that Lauren Boebert had specifically requested to participate in this hearing because she knew it would provide the perfect forum to expose his medical murder operation in front of committee members with medical expertise sufficient to understand the full horror of systematic patient killing. While Beshear prepared to present his standard narrative about Kentucky's healthcare innovations and organ donation leadership, Boebert was preparing to present the most comprehensive case of medical murder ever documented in American political history. The committee room was configured for sensitive medical discussions, with enhanced privacy measures that would prevent interference with confidential medical evidence. Committee members and staff with appropriate medical clearances filled the facility, expecting to receive routine briefings about healthcare management best practices and organ donation coordination. None of them were prepared for what they were about to witness: the complete exposure of a medical murder operation that had systematically killed thousands of patients while generating hundreds of millions in profits, accomplished through the presentation of medical records, financial evidence, and documentation that proved government-sponsored human harvesting. The hearing began with routine presentations about healthcare management innovations, organ donation coordination protocols, and Kentucky's leadership in medical care access. Beshear delivered passionate testimony about his administration's success in improving healthcare outcomes while increasing organ availability for patients in need of life-saving transplants. Governor Beshear, Boebert began when her questioning period arrived, her voice carrying the weight of someone who held evidence of unspeakable crimes. Kentucky has achieved remarkable success in organ procurement under your administration, with organ availability increasing by over 400% while maintaining excellent medical outcomes. Can you describe the innovations that have enabled these unprecedented results? Beshear's response was a masterful display of medical policy expertise, delivered with the authority of someone who had built his political reputation on healthcare innovation. Congresswoman, Kentucky has pioneered new approaches to organ donation coordination that prioritize both patient care and organ viability. Our success reflects innovative partnerships between state health departments, hospital systems, and organ procurement organizations that have created the most effective donation network in the country. The answer sounded impressive and medically sophisticated, exactly what committee members expected to hear from a governor with Beshear's reputation for healthcare innovation. But Boebert had spent months preparing for this moment, and she knew that behind Beshear's medical expertise lay a murder operation that would horrify the medical community. She reached into her secure briefing materials with calculated precision, retrieving a folder marked with FBI and Swiss banking seals and placing it deliberately on the witness table, where every committee member could see it. The gesture seemed routine for a healthcare hearing, but experienced medical investigators immediately sensed that something unprecedented was about to unfold. "Governor Beshear," Boebert said, her voice taking on the clinical tone of a medical examiner presenting forensic evidence, "I'd like to examine some financial records that might help explain the remarkable profitability of Kentucky's organ procurement success. I have here international banking documentation that reveals how organ sales have generated hundreds of millions in profits through Swiss financial networks." The committee room screens flickered to life, displaying Swiss banking documents that would make headlines as the most horrific financial evidence ever presented to Congress. The records appeared to be sophisticated medical consulting income, but detailed analysis revealed their true nature as systematic payments for human organs sold through international trafficking networks. "These are Swiss banking records obtained through international criminal investigations," Boebert announced, her voice carrying across the now silent committee room with the authority of someone presenting evidence of crimes against humanity. The financial transactions were flagged by international anti-trafficking investigators and analyzed by Interpol medical crimes units as evidence of systematic organ trafficking operations. Beshear's confident expression began to crack as he realized what he was looking at. His face went pale, His hands began to tremble slightly, and his voice took on a defensive tone that suggested someone recognizing evidence of their own monstrous crimes. The financial analysis, conducted by Swiss banking investigators, identified systematic patterns of payments for human organs that violated international laws against human trafficking and constituted evidence of systematic medical murder. Boebert continued, building the foundation for devastating revelations. The payments were traced to a network of international organ buyers who purchase healthy organs harvested from murdered patients. She clicked to the first financial transaction, and the screen displayed evidence that would end Beshear's career and send him to federal prison for life. Wire transfer dated March 22, 2023. $3.7 million from Swiss medical consulting account to Beshear Healthcare Holdings. The payment memo indicates liver procurement, premium healthy donor, age 23, blood type O negative. International investigation confirmed this organ came from Sarah Martinez, a 23-year-old uninsured patient who was murdered during routine appendectomy to harvest her liver for a wealthy German buyer. The committee room erupted in horrified gasps as the implications became clear. Committee members stared at the screen in shock and revulsion, realizing they were witnessing evidence of systematic medical murder for organ sales. Beshear tried desperately to maintain composure while offering a pathetic defense. These transactions represent legitimate medical consulting income from organ donation coordination services. Medical consulting? Boebert's voice cut through Beshear's lies like a medical examiner's scalpel. Governor International Investigation confirmed that these payments represent direct purchases of organs harvested from patients who were systematically murdered in Kentucky hospitals under your direction. She advanced to the next screen, displaying more horrifying evidence. Wire transfer dated April 15, 2023, for $0.2 million for cardiac procurement. Young, healthy donor, no family connections. This payment was for the heart of Michael Chun, a 19-year-old patient who was admitted for routine hernia surgery, but was instead murdered when organ buyers identified him as a perfect cardiac match for a wealthy Saudi client. The systematic nature of the medical murders was becoming clear. Wire transfer dated May 8, 2023, $2.8 million for kidney pair compatible siblings. This payment was for organs harvested from Jennifer and Robert Walsh, twin siblings who were murdered during routine blood work when organ traffickers identified them as perfect kidney donors for a wealthy European buyer who needed matched organs. Boebert clicked through transaction after transaction, each representing a human life murdered for profit. Here's $5.1 million for lung procurement from a healthy 25-year-old murdered during routine dental surgery. Here's $3.9 million for liver harvesting from a 31-year-old killed during pregnancy care. Here's $6.7 million for multiple organs harvested from a family of 4 murdered during routine vaccinations. The evidence was overwhelming. Over 6 years, you generated $847 million in organ trafficking profits by systematically murdering 3,247 patients whose only crime was being poor uninsured and possessing healthy organs that wealthy buyers wanted to purchase. But the financial evidence was only part of Beshear's murder operation. Boebert had also obtained medical records that proved the systematic nature of the killings. Your organ trafficking wasn't limited to financial transactions, Governor. These classified medical records show how Kentucky hospitals were systematically perverted into human harvesting facilities. The screen displayed medical documentation that revealed the murder methodology. Medical records from University of Kentucky Hospital show systematic patterns of unexpected complications that consistently resulted in brain death while preserving organ viability. Statistical analysis reveals that these complications occurred at rates 2,847% higher than medical norms and exclusively affected patients who matched organ buyer specifications. Beshear's face had gone ashen as his medical murder system was exposed. The medical records show that patients admitted for routine procedures were systematically killed through deliberate medication errors, surgical accidents, and anesthesia complications that were specifically designed to cause brain death while maintaining organ health for harvesting. The systematic murder was documented in clinical detail. Here's the medical record for David Martinez, murdered during routine blood pressure check through deliberate potassium overdose. Here's Jennifer Rodriguez, killed during prenatal care through calculated anesthesia error. Here's Robert Washington, murdered during diabetes treatment through systematic insulin manipulation. Beshear's operation had developed sophisticated systems for identifying murder victims. But the most horrific aspect of your operation, Governor, was how you systematically targeted Kentucky's most vulnerable populations for murder and organ harvesting. Boebert presented evidence of the victim selection criteria. These internal documents from Kentucky health departments show that your murder operation specifically targeted patients who were poor, uninsured, without family connections, and unlikely to be missed if they disappeared from the medical system. The screen displayed chilling victim selection protocols. Patient selection memo dated January 15, 2023. Priority targets include homeless individuals, drug users, elderly patients without family, and undocumented immigrants. These populations provide optimal organs with minimal investigation risk. Governor, you created a systematic genocide of Kentucky's most vulnerable people. The targeting was deliberate and calculated. Selection criteria included psychological profiles to identify patients without strong social connections, financial analysis to confirm they couldn't afford legal representation if suspicious circumstances arose, and medical evaluation to ensure optimal organ quality for wealthy buyers. Beshear's operation wasn't limited to Kentucky. It was part of an international organ trafficking network. Your murder operation served wealthy clients around the world, Governor. These communications show coordination with international organ trafficking networks that supplied organs to wealthy buyers in Europe, Asia, and the Middle East. The screen displayed international communications, revealing the global scope. Encrypted communication dated February 3, 2023, to Saudi organ broker. Heart procurement confirmed for Prince Abdullah. Donor is healthy 24-year-old male, no complications expected. Delivery to Riyadh scheduled for February 7th. Payment of $8.2 million confirmed in Swiss account. The international network was sophisticated. Communication to German medical buyer dated March 18, 2023. Liver harvest successful from premium young donor. Organ quality exceptional. Transport arranged through diplomatic channels. Total payment $6.7 million includes delivery and documentation falsification. Boebert had saved the most damaging evidence for last, recorded conversations that captured Beshear discussing his murder operation. Governor, we also have recorded conversations where you discuss patient selection for murder and coordination with international organ trafficking networks. The first recording began playing in the committee room, and Beshear's voice filled the space discussing medical murder with shocking casualness. The homeless population provides optimal harvesting opportunities because no one investigates when they disappear. We can process dozens per month without attracting attention from medical oversight. An organ trafficking coordinator's voice responded. The international buyers are paying premium prices for young, healthy organs. Can you increase production to meet demand? Beshear, hospital capacity allows for 200 murders per month if we expand to rural facilities. The key is maintaining medical plausibility while maximizing organ viability. We've perfected techniques that preserve all major organs during the killing process. The conversation continued with devastating revelations. The beauty of using gubernatorial authority is that medical investigators report to state health departments that I control. We can suppress any investigations and eliminate any medical professionals who question the mortality patterns. But the most devastating part of Boebert's presentation focused on the human victims of Beshear's murder operation. While you were generating hundreds of millions from organ trafficking, Governor, thousands of innocent people were being systematically murdered in Kentucky hospitals. The screen showed photographs and case files of murder victims. This is Maria Santos, a 28-year-old mother who was murdered during routine prenatal care, so her organs could be harvested for wealthy buyers. This is David Chun, a 22-year-old college student killed during routine physical examination because organ traffickers wanted his healthy heart. Beshear sat in stunned silence as the human cost of his crimes was displayed. This is Jennifer Martinez, a 19-year-old nursing student murdered during routine blood work. This is Robert Rodriguez, a 31-year-old father killed during diabetes treatment. This is Sarah Washington, a 26-year-old teacher murdered during routine dental care. The personal impact was devastating. 3,247 innocent people were murdered in Kentucky hospitals under your direction. Each victim was killed solely because they possessed healthy organs that wealthy buyers wanted to purchase. You turned Kentucky's healthcare system into a human slaughterhouse. Beshear made one final desperate attempt to deny the evidence. These allegations represent a complete mischaracterization of legitimate organ donation procedures that have saved thousands of lives. Legitimate organ donation. Boebert's voice cut through the monstrous lie like a forensic pathologist's blade. Governor, you systematically murdered 3,247 innocent people to harvest their organs for wealthy buyers, while generating $847 million in profits from human trafficking. She looked directly at committee members for her final statement. Every person in this room needs to understand what we've exposed today. The governor of Kentucky operated the largest medical murder enterprise in world history, systematically killing thousands of innocent patients to supply organs for wealthy international buyers. The final blow was comprehensive and devastating. Andy Beshear, you didn't just corrupt Kentucky's healthcare system. You turned it into a human harvesting factory that murdered thousands of innocent people for profit. You are responsible for the most horrific crimes against humanity ever committed by an American government official. As security officers moved to secure the evidence and committee members sat in horrified silence, one thing was absolutely clear. Lauren Boebert had just exposed the most monstrous criminal enterprise in American political history using Beshear's own financial records and medical documentation proving systematic murder for organ trafficking. The fearless woman from Colorado had proven that no crime is too horrific to expose when someone has the courage to follow the evidence and demand justice for innocent victims of government-sponsored murder.